An occupational therapist's focus of intervention or of treatment would be for participation, engagement, and independence and well-being in occupational roles. And when we talk about occupational roles, we talk about engagement in self-care activities, engagement in leisure pursuits, working or returning to work, caring for my family or my pets or my household. And and I think that's what we mean with occupational roles. So with cancer treatments, has different side effects like pain, weakness, depression, anxiety, fatigue, changes in body image or self-image, and all these side effects of cancer treatments affects a person's ability to engage in their daily occupations, to fulfill their occupational roles, and that is where occupational therapy comes in. So whenever there's changes in a person's mental or physical function, the occupational therapist would help the person to regain skills to engage in these occupations again. So I think if we divide it into the physical, cognitive, social, emotional, and spiritual needs of the client, if we start with the physical needs, it would be things like the person is experiencing swelling in their legs, in their arms, so we're doing edema management. We will address the edema, or we focus on mobility, trying to get the patient, we do wheelchair seatings and prescriptions so that the person can be mobile again. We look at assistive devices or adaptive equipment so that the person can engage in their occupations. We do fine motor therapy or hand therapy if the need is there. Sensory, we work on the sensations of the hand, or maybe if there was sensory loss. We would also address coordination difficulties. Fatigue management we'll address through energy conservation techniques, or pain management through distraction. So I think physically that's some of the things that we will look at. Where if we look cognitively, a person might have chemo brain, as they say, and then we'll use cognitive strategies to address memory difficulties, to address executive functioning difficulties or visual perceptual difficulties. Then when we get to the social, the emotional, the spiritual needs of the client, we could address it through support groups or through reducing stress or anxiety through coping skills. Helping the patient return to the occupations that they engaged in prior to the cancer treatment or the cancer as optimally as possible. I think the main aim of therapy is always for the patient to be as independent as possible through engagement in meaningful activities. While adult patients understand what is occupational therapy or how we're going to help them, children do not always understand, so therapy for children would be disguised in play, where we would address all of these things, but in and through play. Occupational therapy services are claimed directly from medical aids.